Hi, everyone. Thank you for making time today. Today, instead of speaking about technical things, we have two amazing people with us. Now, the reason why we're doing this for the first time is because this young looking 71-year-old man that we have right in front of us right now, yeah, he was on heart medication for a really long time, and his medication has now been halved. But that's not about, it's not really about that. What we're trying to inspire people with today is the fact that a 72-year-old man who's lived a great lifestyle, but unfortunately in between had a couple of complications come in, which he will talk about, has been able to change his lifestyle at this age, reverse his type 2 diabetes, get off his medication with his doctor in loop. And we have Dr. Akshat joining us as well today, because we want to show everyone how you keep it real. And if you're willing to make changes with the right attitude, then literally almost anything can be achieved in this life. Sir, over to you. If you could take a couple of moments to introduce yourself to us, please. And I will leave you with the first question. I would love you to tell us a little bit about your life, your younger days when you were wild and young and free, and then talk to us about the angioplasty that happened, your bypass surgery, the onset of diabetes, and where you are today. If we could start with that, that would be brilliant.
Good afternoon. Thank you for inviting us to this program. I don't know on what basis you have selected us, but all the same, I'm very happy to participate. And if in the course of this talk today, if I can even inspire one person to have a better life, I think the objective of this meeting would have been obtained. Okay.
Absolutely.
Coming back to things about me, first, let me introduce myself. As you rightly said, I'm 72, and in another 1 month, I will be 73. And in this period of 73 years, I lived a varied life, but I would, in principle, like to break it up into 3 parts. First is from age 1 to age 35, which I would say as a youngster or youth. And then from 35 to 59, which I would consider as middle age. And then from 59 till today, which as a senior citizen. So these are the 3 portions, and at each part of my life, certain events have taken place when everything changed. Okay, first let me describe myself as a youngster or in my youthful days. I did what all youngsters do. Unfortunately, we don't learn from other people's experience. We have to learn it the hard way. I did everything that was wrong. I was a foodie. I could never resist food. I just ate, and ate. I could never resist a sweet dish, an ice cream. I never realized that you can refuse an ice cream. Food was a very important aspect, and I really ate like anything. I also had enjoyed alcohol, and I think it was a little overbounds. And as a student up to the age of 25, I smoked. And so this was it. And besides that, actually I had a very bad family history. My father passed away at the age of 44 in just a period of 6 hours. And I was suddenly it had to take over all family responsibilities at the age of 21. So that was the background. And in spite of that, I took life easy. And this is how it was. I was overweight. By the time I was 35, I was around 85 kilos. And this is how it was. Then at my brother's wedding, we had a very close family friend, a very senior doctor, who was a professor of medicine, an MRCP. He was a very good friend and a well-wisher. He told me, Shyam, how old are you? I said, I'm 35. He said, next time you come to Chennai, you please call on me. I'm going to do a complete array of tests on you. So being a well-wisher, when I went to Chennai next, I called on him, and I had no health problems. That's fine. So I visited him, and he wrote out a list of blood tests to be done. Then he wanted one stress test to be done. The stress test was something absolutely new. This is about 40 years back. There was no computerized treadmill had just been introduced, and it was something absolutely new. And even the echocardiogram, people just introduced the echocardiogram. It was not never heard of that before. So he said you have to do an echocardiogram and a stress test. So he referred me to a place where I had to go for a stress test. And I went, the blood tests were all done. And then for the stress test, just before taking the stress test, they said, we need to do an ordinary ECG. Fine. So they did an ECG. And then they looked at me saying, anything wrong with you? I said, no, I'm fine. He said, no, there's something wrong with you. We cannot do the stress test. Go back to your doctor and meet him. So that was the starting of my problems. So I went back to him and he looked at this and then he asked for my cardiogram and this echocardiogram. He looked at the echo and then one person who, even to read the echo, it was very new, you see the technology. So the one doctor said there is a problem. And then we did a repeated echo at another place and they said, you're absolutely fine. There's a lot of confusion. But my doctor was very clear. He said, there you had a silent attack. And he asked me, have you had a problem? I said, no. Then recalling back, I realized that about 3 months back, one fine day, I did have a solid pain in the chest at one particular place. And I consulted the doctor next morning. He came and examined me thoroughly and he said, I can't really diagnose anything. They didn't take an ECG. They didn't expect it to be. And he said it could be gas and gave me bed rest for 3 days. That's it. I became very weak. On the 4th day was my daughter's sports day in the school. And I was there and the nuns had asked me to participate as a volunteer. So I went in and I was feeling exhausted and tired, but somehow managed to run around with those folks. And I think that sort of helped. Okay, so this is what I said. And he said, you seem to have had a silent attack and you need to be investigated further. So, and so he said, you go to Bombay, there they'll give you a nuclear study of your heart, a thallium test where they'll inject you with thallium and then study your heart. So I had to come to Bombay and at the age of 35, this was really bizarre and whole my life, everything changed. So I came down to Bombay and there was only one hospital where they had this test. Just look, and they did this. And after that, they said there's a problem. They didn't give me the report. They said, we send it back to your doctor in Chennai. So the doctor in Chennai looked at it and he said, you need a bypass. And there was no bypass in India in those days, 35 years, 40 years back. There was only one hospital which had started a bypass, which was the railway hospital in Chennai. Okay. Dr. Cherian came, Cherian was there, and there was no other hospital. And if at all anybody need a bypass, they went to America and Dr. Cooley was the name. So my doctor said, you need to go to America and you need a bypass. So with that, again, a new problem. And so anyhow, my mother, my wife and me, we went to US and we didn't go to Texas, but we went to Baltimore where I had a cousin who was a doctor. And he told me, you come over, there are very good doctors in the hospital where I am. University of Maryland Hospital, and we'll do everything here. So I went there. So first day I was there, the next day they did an angio. They did an angio and the doctor was an excellent doctor. He looked at it, he said, yes, there are blockages, but your collaterals are excellent. And you don't need a bypass. And so I said, what do I do now? He said, you get back, you do a yearly once investigation. You need to do a stress test, blood test, and he cut down all my medications and he put me on a simple, said you need to take aspirin every day and you need to exercise. He sort of guided me on lifestyle changes. Came back and my doctor at Chennai was very disappointed, to be honest. He said that they had not done a bypass, he was very disappointed. Though he was a fan. Then life changed from that day onwards. First thing I lost, it made me lose 15 kilos. And giving up food, being a foodie was very, very difficult. It was really, I mean, I would say I had to literally starve and it was very difficult. But, and the withdrawal symptoms was a very difficult part in my life, I would say. But I succeeded, lifestyle changed, started exercising regularly, went for long walks, walk became a habit, food was again very controlled, and my wife took control of the food. She was very particular, and she would see to that I would not go overboard at any stage. So that was, now from phase 1 we went at middle age, and this is how it was. And But things settled down and I accepted that lifestyle. The course of this, the doctor Chennai had also told me one thing. He said, you're an A-type personality. What you need to change is you have to change your way of thinking and listening. And he gave me an example. He said, if you're going to catch a train and you see the train in front of you, but you still are away, don't run to catch it. Miss the train. Yeah. But you miss the train, doesn't matter, but take life as it comes. Don't be in a rush to do things. You want to complete. So that also hit me, and I said, I must change. I was a person, if I take up something, I must finish it that same day, cannot wait. So that's also, life changed. So I started walking regularly, food was under control, and things started working well. Medication was very little, except I was taking those days there was no aspirin. It was Disprin. Half a Disprin in a glass of water, and you mix it and drink it. There was no buffered aspirin like how we get now. And Disprin, and the only thing due to guidance from a friend in America, he said you must take fish capsules. So omega-3, those are 4 capsules I've been taking for the last 40 years now.
Okay.
So the krill, that's how it went. So with this lifestyle change, I lasted for 25 good years. And life went on well. Till one fine day, and as in this 25 years, every year I took an annual complete thorough test. I did a stress test, I did all the blood tests, I did an echocardiogram, I did all that was necessary, and things went on well. There was absolutely no problem. Then one fine day, when on one of these annual tests, I did an echocardiogram, I did a stress test. The stress test was negative for ischemia. And I asked the doctor, there's a new test that has come about.
The CT angio.
Yeah, CT angio, correct. I said, do I need to do that? I believe that's a new test. He looked at me for 5-10 minutes. He's saying, okay, since you're asking for it, you better have it done. So we did a CT angio. Came back and the results said that there's some problems. That was again the starting of my problems. So they did that and they said, you need to do an angio immediately. Though the stress test was negative, the CT angio said something and they said, you need to do an angio. They did an angio and they said there are 5 blockages and you need to have a bypass immediately. So again, another state of shock. I'm absolutely healthy. I can walk, I can run, I'm doing everything. But the doctor said you need to have a bypass. So while I was thinking, my children, my daughter and son-in-law picked up my files. They went and met another doctor friend of theirs, a leading surgeon of Bombay. And they fixed up an appointment for a surgery without even asking me.
Okay.
They came back and they said, we fixed up your surgery for this date and you're in a state of shock, Anyway, I said, they're my well-wishers and the doctor also feels so. Surgery was fixed up and surgery was done. And 5 blockages were, there were 5 blockages and things went off very well. And I came back and now again, things change in the sense, as per the normal protocol of surgery, bypass surgery, once your surgery is done, they put you on some drugs. Yeah. They put you on a beta blocker. They put you on blood thinners. Then they put you on statins. Whether you have a problem or not, you need to take statins. Yeah. So there's a I started taking new type of tablets. In the meanwhile, I think I should mention here, I have absolutely no family history of diabetics. My father, mother were not diabetics. My grandparents from both sides, paternal, are not diabetics. No history of diabetics in the family from any way. And as I told you, the last 25 years before my surgery, I led rather a healthy lifestyle. I walked regularly. I was conscious of what I was eating, etc. So this is how it was. And I had to take all these drugs. That started and so that's how it was. And I had to take also one thing good was very regular with my exercise. Even after bypass, my bypass took place in the month of August or September. August, and in the month of February, it's been a sort of a tradition for last 20 years that every year on my birthday I go to Vaishno Devi temple at Jammu. So I asked my doctor in charge of cardiac rehab whether I could go to Jammu and whether I could trek that 14 kilos. He looked at me and said, "What's wrong with you? You're more healthier than a normal person." So he really encouraged me. And he said, "You're more healthier than a person who's not done a bypass. Everything is fine with you. Please go ahead." So he pushed me to, and that sort of gave me a long push and an encouragement that I'm absolutely fine. And I started exercising regularly. So then they also guided me. They said I should participate in the dream run of the Standard Chartered Marathon. That was the beginning of a new thing. So we participated in that, and it went off well. And as things progressed, I saw some of my friends were all bypass patients started participating in half marathons. So I also joined them, and it became a sort of thing. And in the last 13 years, I participated in 13 half marathons.
It's amazing.
Okay. So then the
That's
question
amazing.
is, since last 5 years, I would say, I suddenly realized on my tests that my blood sugars were going up. So this was a new development. And it made me really think why my blood sugar should be going up, because I led a healthy lifestyle. And then it's assumed that it is probably due to the drugs that I was taking. It could be due to the statin. They say 30% of all patients who take statin get diabetic. This is one study. And then there was that even the Seloken, that is the beta blocker, could also instigate diabetics. So whatever it was, now I went to a doctor who was a specialist in diabetics, and then for some time kept watch on me, and then he finally said, "Now you have to start a drug," and he gave me this
Metformin.
Metformin, and yeah. So, but it did not bring down my blood sugars at all. I took it for almost, I would say, more than 6 to 8 months. I went back to him as I was thinking, and I said, "Doc, that doesn't seem to be working." He said, "It's a very safe drug. You need to increase the dosage." So increased it by double. He says, "Now 1 in the morning, 1 in the night. This will solve your problem." So we started with double dosage, but it really did not help at all. And I was totally confused and not too happy with things. So this is how it was. I was leading a good lifestyle, but my blood sugars were going up. And in this process, my daughter insisted that I should see you, to be honest. I didn't know what Luke was. I didn't know what you do or anything, but she insisted. She said, "No." And then I came, and then you sort of fine-tuned my life still further and started changing my food habits, fine-tuned my food habits. And this is how it started. Then, of course, for about 3 months, I think there was no change. But after 3 months, for the first time, I could see my blood sugar had come down to absolutely normal levels. So that was the drastic change. So since then, I have been following the things that have been given to me now and making changes as and when you have been telling me. And I'm very happy with the blood levels. It is now, I would say, from August 2019, I'm off medication. So almost 1.5 years. And I'm off diabetic medication, taking nothing. I'm just taking natural things. Okay.
Yeah.
And also now for a statin, because my triglycerides was initially high, they've given me a combination drug.
Yes.
That has also been removed and made only a single statin. So my statin has also been reduced to almost, say, half. And even the aspirin that I was taking, I was originally taking 150. For the last 6 months, it has been brought down to 75. So half the dosage. I understand 75 dosage is what even normal people are advised to take all over. So that's how it is. So at the moment, my medicines have come down. I'm leading a healthy lifestyle, and this has been the third portion of my life, as I said, as a senior citizen. I've explained myself. If you have any questions to ask me, please do ask me.
No, thank you so
Okay,
much,
I'll
Uncle.
just
Your
say-
journey itself is inspiring. If it doesn't inspire other people, it's inspired our team for sure. No, and the reason why, the reason why is, to be quite honest, we do this with people all the time, all around the world, but my point is at the age of 72, for you to make lifestyle changes. And thank you for being so honest about your lifestyle. The prior days, the smoking, it's nice because see, everyone, we all, I'm not going to call them mistakes, but we go through phases in life. And, when the body gives us symptoms and warnings, if we listen to it and make changes, we can improve, we can get better. But if we don't, then the disease becomes worse. But I must ask you, you mentioned your wife several times. So, ma'am, how easy was it to get him to make the food changes? And if I have to ask you, what are the 2 or 3 major changes that you made in his overall food habits for him to reach this space? What would that be?
Yeah. See, the thing is, I started taking more interest in, healthy foods, finding out details about good food, and because he loves good food. So I even went to learn few things and started, experimenting, and slowly we have brought him to this level. Basically, I look that the food has to look good, it has to taste good, and there has to be a variety. That's the best way to keep him off outside food. So, in my own small way, I try to be innovative, and I try to, try out new recipes with the healthier versions. And we've all grown up on wrong foods, but I've tried to make the wrong foods into healthier versions of that. So.
Right. No, I think that's amazing. It also shows the amount of support, because we always tell people, if you're blessed to have your partner and a family around, they are also your most powerful drug. It's not just the medicine. You need to have family support. You have to have someone who's trying to make food look good and taste good. Otherwise, it's simple. We're all going to go outside and eat restaurant food and 5-star food, which tastes way better. But if we're getting it at home, there's no reason why we would ever make that an outside habit. So I think that plays a massive role in healing. A lot of people think it's only about diet and exercise, but honestly, and medicine, all are needed. But I really think it's family support, social groups, everything that you put together, and a positive attitude as well. Uncle, your attitude seems to be so strong and solid, and I think one of the biggest game changers for you, like I said, food, everything else, is when you change the way you react to stress. When you learn to take it a little bit easy. Because if you ask me, 90% of our cardiovascular patients, stress is the number 1 cause. Then comes diet, and it's correlated. If you're stressed out, you're never going to eat the right foods. You're going to eat the wrong foods that give you quick energy, like sugar and carbs and all of those things. So uncle and auntie, if I asked you all like 1 or 2 messages, 1 message each that each of you all would want to give our generation, anyone watching this, because I think, you've just taken care of something which is huge. A lot of people don't think they can ever get off medication. It's stuck in their mind, so they don't try to change. But at 72 years old, you managed to do it with your lifestyle changes, with the help of your doctors, the team, everything together. But you've done it. Metformin from 1,000 has come to nothing. Your statin from a combo, you move to 1. Your aspirin is down by half. Advised by your doctor. That's the best part of it all. So what are a nice message that you would like to leave, all of us with? It could be anything in relation to your health, in relation to life, whatever it is, because you all have gained so much experience over the years, and we would love for you to share it with us. What would it be?
I would say 2 things. First is, I would say health is wealth. You can have millions, but unless you have health, you cannot enjoy those millions. So health is wealth. And for health, the rules are very simple. Lead a simple life. Have control over your food. Exercise well. Take time for prayer. Sleep well and drink a lot of water. This is advice not from you, but I'm just repeating it.
Thanks, uncle. That's the same advice I talk about every day to everyone, but still people pay me to make them implement that advice, even though they know it. No, thank you, Uncle. That's a perfect message. I really appreciate that. Ma'am, you as well, please give us your advice as well, or a message for us.
Yes, I think we all adults, I mean, with children, we should inculcate the right food habits from childhood. Because we've grown up on the wrong foods, so we are so hooked onto it. So if you inculcate the right food habits from childhood, probably they'll be healthier adults.
Adults. Absolutely.
I agree with her, because actually habits are made in childhood. And what we eat in childhood, we think they are the right foods, and that's how it is. So then it becomes very difficult to change. So we must inculcate good food habits in our children from childhood itself. That I agree with her.
Oh, that's amazing. I love your messages. And we have Dr. Akshat, who heads the medical vertical as well. Dr. Akshat, as a neutral, party to all of this, what is it that you think worked for Uncle, to get him off the medication and all? What are the top 2 or 3 solid lifestyle changes that you think helped Uncle to get off it? Because he was already exercising, running marathons and doing everything. But yet we, of course, know that the statin contributed to the sudden rise in his blood sugar levels. What is it that you would want to leave our viewers with as well, Dr. Akshat, from the medical observation aspect of this?
I think, see, one thing is what is important is he's very open to making changes. Yeah. Even because, his daughter put him onto the program, he still joined it. And, he was participating, full-heartedly. So even when we put the device on his arm to check his fluctuations in the sugars and all, he was okay to go ahead and do it. So I would say that the first thing is his openness. He's okay to do something to help himself. So I think that is the first attitude, to make a change. He's open to do it. Even at, we say that as we grow older, we get more rigid. But I don't think it's true for him. So I think one thing that is extremely important. And other than that, honestly, we've not done anything very specific, but there were things like, few superfoods like jamun vinegar is something which I, in fact, he was the one who told me which worked really well for him. Okay. And, of course, we've done it in phases and all, we cannot just keep giving the superfood. So we mix and match. So few changes here and there definitely helps. And I think stress levels, again, it's going to come back to that only. His doctor told him about the type of personality. And I do know, that he does tend to stress even today. I think that's, very, very natural. We don't have a choice. That's how we are. We can't change who we are. But I think he is definitely managing a little bit better. So my thing would be eventually it's going to come down to the mind and a few guidance from our side from a superfood perspective and a little technology. I would say, using the device, to understand what was increasing the sugar levels also, which help us take him off the medications, reduce the statin. If we are saying that the medicines were increasing the diabetes, reducing the medications a little bit obviously had an impact also. So like a 360-degree circle, basically.
Yeah, no, thanks, Dr. Akshat. Thanks for keeping it simple, because that's what we want to show people, that it is simplicity at the end of the day. And like you rightly said, the right attitude. If Uncle didn't have the right attitude and he wasn't open to it, whether there's the best medicine in the world, the best surgeons, doctors, nutritionists, it's never going to work. We have to be open to change, and Uncle demonstrated that, which I think is fabulous. So again, it comes down to simplicity. It comes down to our belief that we can get better and everything that we can do. Uncle, before we end, I want to... Yes.
Yeah.
Okay. So, Uncle, I also want to mention that you had mentioned that before the bypass surgery, when you did your CT, you were thinking, and even the doctors had asked you, is there anything wrong with you? And you said, no, you were fine. You were running, you were walking, you were doing everything. How could these, blockages not show up as symptoms? Just to explain to you and everyone else, the heart has a beautiful intelligent system called angiogenesis. Angiogenesis is a system where it's the body's intelligence that grows new blood vessels and stops the growth at the right time. Now, with 5 blockages, as per, a book, you would either be in hospital, you would be breathless, your pressure would be right to the top, or you would have already had, a heart attack. But why you never had all of that stuff is because your heart's angiogenesis kicked in. It was growing new arteries that automatically bypass the 5 arteries that had blockages in. So you see, there is an intelligence in the human body that is working for us. Now, had you not changed your lifestyle and angiogenesis gets compromised. And those 5 blockages, sometimes the warning may not just be a simple warning. It could have resulted in a complete cardiac arrest. So you see, there's an intelligence in our body that actually kept you going. You could still run because it's simple thing. If there's a blockage, the blood flow is reduced, blood pressure goes up, palpitations, no energy, fatigue, and tiredness. You didn't have any one of them because your heart had already developed new arteries. So, that's something we should always have faith in our body. There is an intelligence working for all of us. It doesn't mean we ignore our yearly tests and all of that stuff. We do it. But otherwise, a lot of people are always stressed. Am I going to get a heart attack? Am I going to die? Is this going to happen? No, trust that your body is doing the right thing at the right time, as long as you are giving the basics, which is exactly what Uncle said. Exercise, sleep, taking life easy, eating the right kinds of foods. Uncle and Auntie, thank you so much for joining us and sharing this experience. I bet you've inspired a lot more people. And that was the whole objective.
Our pleasure.
Of doing this. And thank you for sharing your wisdom and message with all of us as well. Truly appreciate it. Thank you so much.
Thank you. I enjoyed.
Thank you, Dr. Akshat. Thank you, everyone.
Thank you.
Bye, ma'am. See you.
Bye-bye.
Bye-bye.
Bye-bye.